5, 4, 3, 2, 1. Welcome to another episode of Dr. Dallas Unleashed. We're here with Dr. Rejuvenation on my left.
Hoot, hoot.
And of course, I am here as well. And this is going to be another podcast where it's kind of like hard-hitting facts about surgery. And the title of this is going to be, How Can You Have a Safe Surgery During COVID-19 Pandemic? So, you know, with all this stuff going on, we still are operating, but we're operating under conditions that we feel are the safest environment for our patients. But there are things to do for patients to make sure that you really optimize yourself, your immune system, and that's what we want to go over today. So we're going to go over that. Dr. Rejuvenation is going to give us some, her ideas and thoughts about some of these. But if you listen to this, take notes. It's going to be on YouTube. So just make sure you really take some good notes because there's going to be some really juicy information.
And I think this not only pertains to his surgery, but it pertains to Dr. Rejuvenation surgery as well. And so let's get started.
So the surgeries that I do up top and then you do down bottom.
Below.
Yeah.
Below the belt, everybody.
Arrows point to my groins in the middle of the growing area.
Yeah. But I don't operate on males, just females.
Correct. Yes. So, those of you who've been following sports and been noticing how sports are coming back, and we're seeing the NFL, NBA, and Major League Baseball come back. But I really like the NBA, the way they're doing it.
So grateful that sports are coming back. A little bit of normalcy is appreciated.
Right. And they're doing that bubble, right? So their basketball players are going to, I believe, Orlando, right? I think it's a Disney resort there.
Yep.
And so they're all going to this one place. And so it's like a bubble, a shield where, pretty much they're limiting all the people that go in and out of this bubble. They're not traveling. They're not going by airplane. So they're really limiting their contact and minimizing and testing them every day. So I want to call this, what we recommend to people is kind of think of this as your surgical bubble, right?
Pre-surgery bubble.
So you're going to have surgery and, typically I think of that bubble starting 2 weeks before and then really extending 4 weeks after surgery. So we're looking at maybe a 6 to 8 week bubble that would start, I would say, about 2 weeks before. Would you think that's okay?
And the most important, I know 6 weeks or 8 weeks is a really long time, right? But I think that 2 weeks beforehand is the most critical part.
Right.
To kind of prepare yourself and protect yourself.
To make sure that, going into the surgery, there's no signs, symptoms, any reason why you would be a higher risk of having or contracted COVID-19. So I'm going to call this our surgical bubble that you get ready 2 weeks before. And what does that mean? Well, as you guys know, limiting or minimizing your contact with other people in groups of people, especially over 15. But if you have to do it, go to the grocery store. There might be Kroger's where you're at, grocery stores, Walmart's, Target's are probably the most common. If you could limit it or maybe just not go and have a friend do these things or try to stock up maybe 3 or 4 weeks before, then you're not going to a place where lots of people, hundreds of people pass through every single day and touch, and you're going there and looking at your Red Bull or fudge stripe cookies and whatever.
Is that what you're looking at?
Yeah, that's what I'm looking at. Although I've stopped the fudge stripe cookies, I'm not doing that anymore. But they're so good, and Luke and Nico really like them.
They sure do.
But I recommend if you're going to do that, maybe stock up on some of those things 2 weeks before. During that 2 week pre-surgery date, this is your bubble. So have someone else go, right?
So we're really trying to minimize your exposure or risk. And if you do have to go, I usually go really early in the morning where it's not like 300 people are in the store. Or you can
What's
pre-order.
What's early, Dr. Rejuvenation?
Well, for me, it's not that early. It's probably between the 8 to 9 window for me. Because normally we're up even earlier when we operate. But on the weekends, it's 8 or 9.
Right.
Or when I had my surgery, I was ordering online on their app and then having them take it out to my trunk, which was awesome. Awesome.
Yeah. So there's those, the ability with an app or something where you can just order it. You drive up to that parking space and then that young man or woman comes and puts it in your trunk, right?
And then off you go.
Yeah. So definitely start minimizing or just don't go to these places, stores 2 weeks before you start your surgical bubble. wear a mask. I think this is probably, and I know it's very divisive right now. There is sort of this general, I think people understand that masks are a good thing, but.
And it's mandatory.
Right. But there are some places, in the United States where it's not mandatory. But I think that when you're thinking about a mask before surgery, think of it as part of your bubble, because the way I would look at it is right now, when you go in your car and wear your seatbelt, it's not room for debate, right? You get in trouble if you don't do it. You just do it, right? And I think that's how you should think about a mask. At least the 2 weeks before surgery it's not up for discussion. You should just do it when you're out. It will help prevent, even if it's 10% less chance, it's still 10% chance, even though I'm sure it's a lot more than that. It's still very helpful. So wear a mask.
And even as a physical barrier, it's preventing you from touching your face. So I think that's a nice reminder.
Yeah.
And remember, the mask should cover your nose. So it doesn't count if you're
if you're watching the YouTube video like this.
Versus half the time, yeah. Doesn't count.
I heard it's like wearing a condom with the tip of the condom cut off.
Okay.
You got to wear the whole thing.
Yes. Correct.
You never heard that?
Yes, I have.
Okay. Well, anyway, so wear your mask, wash your hands, practice social distancing. I know people are listening like, okay, I've heard this 1,000 times, but remember, this is practice this as your surgical bubble. Mask, wash hands. And if you are going to be in a place where there might be more than just you and a couple other people, let's say 15 or more, practice social distancing. And if you can't practice social distancing, just don't go to that place. And so I think those are some of the hard decisions you'll have to make 2 weeks before and in your post-op recovery. I think your post-op recovery is a little bit easier though, because you're going to be home resting anyways. Right. So a lot of these hard decisions, hopefully they're not too hard, to do these things happens really 2 weeks before, right?
Yep.
So those are the obvious things. I know for my surgeries, we tell our patients to start a multivitamin tablet and an iron tablet. I think that's really important. People get too much information on the website, like, oh, I should get zinc, I need to get extra vitamin D, blah, blah, blah. I think that can be overwhelming to people. I think it's really easy just to add a multivitamin tablet and then an iron tablet. The reason we do iron is when I do liposuction, there's going to be some oozing and bleeding. That'll just help you with your blood levels after a surgery where it's relatively long and we're doing liposuction, which can create some bleeding. Do you ask women who need surgery down below to do anything?
Yeah, to be honest, I don't. We don't experience a lot of blood loss with my types of surgery, so iron I don't recommend. But I do. It does make sense if you're going to be having liposuction. There can be some significant blood loss. Don't forget, iron can constipate you though, so it might make your poop kind of hard. So you'll want to take a stool softener with that if you're going to take iron. But I always say fill up that gas tank with some iron, because that will help you for sure. And I'm not opposed to multivitamin. I don't require it, but that makes sense.
So those are pretty easy things. And that's, what we'd recommend, even, despite a pandemic of COVID-19. These are just things to have a great recovery and a very stable recovery. Now, here's some things when we think about, the pandemic and all the things we do to prevent, like these physical barriers. But a lot of people forget, what do you think is the best defense for any type of virus? The best defense that we have, better than any medication, better than any drug that the pharmaceutical companies, the best that's taken millions of years to evolve, is our own immune system. Mm-hmm. And so if we can optimize our own immune system, that's so important, because that's the easiest thing to do. Your biggest grenade launcher against all these, we'll just pretend they're like, evil demons or something, right? Your best rocket launcher is your own immune system, better than any vitamin, anything like that. So to help you with your immune system, one of the few things, or I guess there's lots of things, but one of the easiest things you can do is exercise. And I know people go, oh, exercise. People tell me I've been needing to exercise my whole life. If you don't do anything, I think the easiest thing just to start is walk 20 minutes a day, right? And
you'll find it boosts your energy. You just feel like you've got more energy and endurance. And believe it or not, you're going to want that energy when you're recovering.
So if you can boost your energy, that helps you with recovery and on a surgery. It helps you sleep even after surgery, because, sometimes with all these medications, they can kind of mess up with your, sleep cycle. That exercise will really help you recover better. But even more importantly, exercise in many studies have shown to really boost your immune system. Your immune system is made up of T cells and different types of cells that create antibodies. And it's shown that the productivity of your antibodies and your T cells and those things that attack viruses go way up when you exercise, even if it's 20 minutes. And that's why I say 20 minutes a day is best. Now, if you're already exercising and running, then perfect. But if you're not doing anything, I think it's hard to tell someone, okay, go to the gym and start working out for an hour. That gives me anxiety because I don't even know what to do for an hour. But if you'd say, okay, ride a bike, walk around the neighborhood. If you've already been doing that, maybe turn it into a little jog. If you can do that 2 weeks every day before surgery, you're going to do that much better. I would say even 50% better on your recovery, and you're going to decrease your chance of, even if you come in contact with the virus, you have a better chance of maybe not contracting it or having one of those COVID-19s where you don't have any symptoms. Those people who are
really
just like
mild case where it's just a sniffle and a sore throat.
Right. And they're just like, oh, I got to blow my nose. Oh, that was my COVID-19, as opposed to the next person who may be on the ventilator and all that stuff. And I really think it's because their immune system is much more prepared for, an attack of that sort of virus. So exercise 20 minutes. If that means just walking, do it. The other thing is stop sugary drinks, or I just say sugary snacks. So anything like soft drinks, that means your Dr. Peppers, your Coca-Colas, Gatorade with sugar, chips.
It's so tough.
I know. Desserts. So if you're like a sweet tooth and you like your carrot cake, yes, I like
That's
carrot
me.
cake. Cake after, eating just a normal dinner or whatever, you have to really stop that. Even if it's those 2 weeks, just 2 weeks before, it will help your immune system. It will help you recover, because when your body sees an insulin spike in your blood, your blood glucose in your blood system, it inhibits the activity of your immune system. So people who are typically overweight, maybe have diabetes, people who are always eating sugary type of snacks, they're the ones who are more likely to get COVID-19. They're also the ones to have a more serious course because their immune system is just not geared up. It's being constantly suppressed with all these sugary type things. So I know it's a hard thing, but if we can get you to do it for 2 weeks, I think that's so important, whether it's a surgery like mine, which is a little bit longer sometimes. Dr. Wen has a surgery to recuperate, have all the stitches and everything healed just right. I think it's really important.
And I even say, like, after surgery, if you can try to avoid sugars, it's great because, one, you'll have more energy. Number two is bacteria love sugar. And so for my types of surgeries, it's not uncommon that patient might have like a vaginal infection afterwards or a bladder infection afterwards. So if we can try to cut down on that sugar, then we're not really feeding that bacteria or inviting that bacteria.
Exactly. So, and with this sort of surgical bubble that we're talking about, we're really just asking, if you're someone who's got a sweet tooth, give it the full, let's say 6 weeks, 8 weeks before you do it, 2 weeks before, 4 weeks afterwards. And trust me, you'll be better off. We want to help your immune system. We want to fight those evil, virus demons. And this is going to be your best way to do it. So another one, and this is pretty easy, and you read this across books and hear this, but getting 8 hours of sleep, really getting enough sleep. If you're someone who's going to bed late constantly, drinking caffeine to wake up at, 5 o'clock in the morning and then not going to bed till midnight, you are going to see higher levels of stress and cortisol, and those things suppress your immune system, whereas sleeping a full 8 hours really enhances your immune system. And so again, so many studies that prove it, that's very true about the immune system. But it's just, I think, a simple thing to really start to think about and actively do 2 weeks before and 2 weeks after. Now, after surgery, probably maybe easier because you're taking Norco and some pain medications and you might be a little zonked out. But the 2 weeks before, again, this is where you go, you know what? 10 o'clock, I'm going to put the book down, turn off the TV, start relaxing, turn off the phone,
That's a hard one.
Yeah.
It's a hard habit to break.
Yeah.
So I like to go to bed late too, but I think anyone can do anything for 14 days before surgery,
Yeah.
right?
So if you can try to, get those lights off, get yourself in bed and not be looking at your phone, because they say some of the light from the phone triggers in your brain the bright light that you might see during the day. And so it doesn't let your system sort of know it's time to cool down and go to sleep. So full 8 hours can really enhance your immune system. Again, they've shown this with mice and different, animals, that they really have trouble fighting different infections when they don't get 8 hours of sleep. And actually your ability to fight cancer. Your immune system also fights cancer, and that is suppressed when you don't get 8 hours of sleep as well. So just a little tidbit there. If you guys have a history of, cancer in the family, breast cancer, whatever it might be, 8 hours of sleep enhances your body's innate ability to fight cancer cells that might otherwise form. People always ask about, and we just talked about multivitamins. We just recommend multivitamin tablet with an iron tablet, but you don't need to go and get zinc and vitamin E and vitamin B12, but you don't need to take an excess of those. Oftentimes people, will go to GNC in these places and just think, oh, this is going to help me with my scar. This is going to help with fluid and all that. If you're healthy and you eat healthy, you don't need a lot of those extra things. Your multivitamin tablet will help you. And the only thing I request is that you take an iron tablet. Don't worry about all the other things. Your body can't use it all, and you end up just peeing it off, right? Or pooping it out. But most of the time, the vitamins in excess are usually run through the kidney, and you just end up peeing it off. So don't get anxious about taking all these other things. Just take the simple things we recommend. Of course, take your own medications, as we tell you. Some of them are very important to keep taking, and there's a few that we ask you to stop, and those are details you can get into a pre-op. But just an overall surgical bubble. Don't worry about all the other extra medications. And here's another personal one, and let's see if Dr. Rejuvenation knows what I do. What do I drink every morning before I go to work?
Coffee.
No.
Besides coffee?
Besides coffee. What do I do at home before I get here to the office?
Lots of lemons.
Okay, lemons. I've been buying lots of lemons. And so, I'd been reading a bunch of stuff, and people had said that drinking, let's say, get half a lemon, squeeze that into 8 ounces of water with a little bit of salt can be really healthy. It helps support a lot of different things. And not only does it enhance your immune system, but it can do other things for weight loss. So let me just go over those. The first one is, I drink 8 ounces of water with a lemon because it helps prevent dehydration. Okay, duh. It's water, right? It's going to help you that. I read that somewhere on Google, and I'm just like, yeah, thank you. I could probably drink like Coca-Cola and be like, yeah, it's going to prevent me from getting dehydrated. But, obviously the sugar and all that. So that's an obvious one. It also assists in digestion. It actually gets some of your digestive stuff ready to go. It doesn't start releasing a lot of the acid, so you don't get, indigestion, but it just kind of gears you up for the day a little bit. So it helps support digestion. On the converse side, it helps support weight loss. And so, having that vitamin, or I guess the lemon, which has a lot of vitamin C in it and other types of antioxidants, it helps support your body when you start eating food and you have a spike in your blood glucose. It helps kind of keep those spikes to a little bit more of a lower level. And so it essentially helps you digest those sugary stuff, doesn't let your body, try to hold on to a lot of that sugar. So it supports weight loss. And so those benefits right there already, you're kind of helping yourself when you're eating some of those things that may have a little bit of sugar, because everything eventually breaks down to some form of sugar, but also supports the weight loss along with it. Helps support your immune system because there's a lot of antioxidants in there. There's these things called phenols, something like that. I'm not an expert when it comes to like the organic chemistry, but I know it's good. And it helps with, fighting it's antioxidants that will fight some of the things that occur in our body, just normal chemical reactions. So what does that do? That's going to help support the way your skin looks, prevent fine lines and wrinkles. And they do that because it's fighting all those, or it's using the antioxidants. And that's what they prove it in mice. Those nude mice with no hair, they have less wrinkles when they give them vitamin C or lemon. Did you know that? Yeah. So it'll help with wrinkles. So that's sort of something that I've been doing. And the other thing, which is sort of anecdotal, so this is just what I've read. I don't know if this is true, but they say when you drink the salt water with a lemon, there's it's very acidic, right? Lemon is, when you taste it, it's like your face kind of gets all squinchy. But when it's sort of in the back of your nasopharynx like that, after you swallow it, it makes it a harder environment for the virus to attach to. That's anecdotal, meaning we're not sure. I don't think it's really been proven. And I'm sure after an hour or so, some of that stuff is not hanging around anymore, your own saliva and spit you swallowed. But I kind of like that idea that, if you're just doing it at the beginning of the day, you just give your body that much less of a chance to maybe not contract, the virus, because you've created a hostile environment, because that virus likes to stick to the nasopharynx, which is, behind the nose and the back of your throat area. So
it's like you've created this shield.
Yeah. So that's what I consider our surgical bubble, to do all these things. And I'll go over them in just a second, just as a hit list. But have you found anything very helpful for your patients, that you've recommended them to do, prior to surgery, especially during this time?
I think really, like you said, like healthy diet, exercise, stay really hydrated, try to boost up your energy as much as you can.
Yeah.
And so even for those of us who aren't used to working out every day, or nor do we have the time to work out every day, like Dr. Dallas said, like those 2 weeks, if you can even start to condition yourself to just do a 20-minute walk and go to bed early, I think that's super helpful.
So let's just go over it point by point. So if you were listening and we were talking off on a tangent and you want to take your notes now, this is what it is. So this is the Dr. Dallas, Dr. Rejuvenation surgical bubble that you're going to be in once you've decided to have surgery. It starts 2 weeks before surgery and extends to 4 weeks after your surgery. Think of yourself in this bubble now. And it starts with, number one, practice social distancing and avoid contact with places where there might be more than about 15 people. Example, Target, Walmart, your grocery store. Have your friend go there if you can, or order it on the app and have somebody put it in your trunk, but minimize that contact. Wear your mask, right? Wear your mask out and wear it properly over the nose, over the mouth, and wear that when you're out and about, whether if you have to go to the bank or you have to do an errand, go ahead and wear that mask. Wash your hands frequently. Very important. If you can't remember to do it, normally just think of yourself as being in this bubble for 2 weeks, and you got to be more obsessive compulsive about it.
And even if you're using the sanitizers, as soon as I get home, immediately I'm washing my hands, right?
Yeah.
So, wash your hands.
Yes.
Best thing you can do.
Take a multivitamin tablet and an iron tablet, usually starting 2 weeks before surgery. Don't need all the extra stuff. So all those extra bottles you see at GNC and Kroger and Sprouts, and don't worry about it. It's too much. If you can just focus on those two little things, you'll do great. And of course, we'll give you, some of the information about your own personal medications. But when it comes to the outside stuff, just a multivitamin tablet with an iron tablet. Exercise. If you don't do anything, 20 minutes walking around the neighborhood. I know any of you guys can do it, because if you can't do it, then you shouldn't be having surgery, because that means you don't have any energy or anything to really get around. How do you expect to recuperate after surgery? So 20 minutes of just walking around. If you're already doing that, maybe turn it into a jog. And, I'm not real big on you need to lift a lot of weights or go to the gym. It's really about the cardiovascular portion, raising your heart rate for, 15, 20 minutes every day. So important. Stop the sugary snacks. So if you're a Dr. Pepper, Coke, Sprite drinker, and you feel like you have to have one of those at dinner or lunch, 2 weeks before, just cut it out. You're a water drinker, for 2 weeks before and 2 weeks after. Just think of it. I just got to have water. If you can cut out the sugary snacks like chips and Cheetos, fries, even those sorts of things, they don't seem like they have a lot of sugar to them, but the carbohydrates are the bad ones that break down into the unnecessary, sugar in your blood system. And desserts. If it's somebody's birthday, pass on the cake. Sorry, Dr. Rejuvenation and your carrot cake for people's birthdays. Although I love carrot cake too. But if I was going to have surgery, I'd be done with it, at least for the 2 weeks before and 6 weeks afterwards. Sleep. Get 8 hours of sleep. Really easy to do, but that means you have to think, in the evening that you're going to shut things down by 10 o'clock. That means turn off the TV, turn off the lights, nothing on the phone, because even that light in your eyes won't let your body kind of slow down, and try to have your eyes starting to fall asleep around 10:15. Really important. That's going to help your immune system. And my personal one is the lemon water with a little bit of salt. So I just take 8 ounces, and I didn't mention this before, but it's 8 ounces of room temperature water, just a dash of salt, and I usually get half a lemon and squeeze it. Really easy to do. Lemons are cheap. You just do it every morning, and you get all those things that I talked about. Supports your immune system, supports weight loss, helps your ability to, really manage some of the glucose spikes throughout the day. And it's also going to help you with wrinkles. I mean, what's better than that, right? Less wrinkles, around your crow's feet, your forehead. And it's a cheap thing to do, just like sunscreen is, right? Sunscreen, when you're out in the sun, is going to help you later on in life. This is something that's going to help you right then and there, in addition to kind of helping prevent the virus if you were to get it or prevent you from getting it. Because the big thing is, even if you do contract it, we want to give yourself the best chance to have one of those easy courses you hear everybody have, right? Oh, it was so easy. I just felt a little tickle in my booty or my nose, and like that was it. We want you to have one of those courses if you were to get it, and we don't want you to get it. That's why we're creating this and advocating for this surgical bubble. So there you have it, guys. Anything else, Dr. Rejuvenation?
Quick and simple.
So thank you for listening. This was tried to be really dense in some of the important things to do during this time, during COVID-19, so you can have a safe surgery. And even if, you're not having surgery, these are things you can do to really help your immune system. So when you're out there and suppose it does happen, you're going to kick that COVID-19's ass, right? Yeah.
Amen.
So thank you for joining us for another episode of Dr. Dallas Unleashed. Until next time, thank you for my guest, Dr. Rejuvenation, and we'll see you guys next time.
Bye.
Bye-bye.